Hello and welcome. My name is Genevieve Form, and I'm a family nurse practitioner and Doctor of Nursing practice candidate with a focus on metabolic health. I'm also precision nutrition certified as a specialist in nutrition for metabolic health. In my clinical work, I frequently see patients who struggle with weight gain, fatigue, and metabolic changes that often appear after the age of 40. I created the Insulin and Fasting Blueprint to explain how insulin, nutrition, and fasting influence the body's ability to store and use energy. In this program, you will learn why weight loss often becomes more difficult after the age of 40. We will explore the role of insulin in fat storage, how frequent eating affects metabolism, and why fasting can help the body access stored energy. The goal of this course is to give you a clear understanding of how metabolism works so you can make informed decisions about nutrition and fasting strategies. In this lesson, we will take a closer look at how insulin works inside the body. Understanding the insulin mechanism helps explain why the body stores fat and why lowering insulin levels can allow stored energy to be used. Once you understand this process, many common weight loss frustrations begin to make much more sense. Insulin is a hormone released by the pancreas. Its main role is to help move glucose from the bloodstream into the body's cells. Cells use glucose as a source of energy to support normal body functions. However, when more energy is available than the body needs, some of that excess energy can be stored for later use, often in the form of body fat. When we eat, especially foods that contain carbohydrates, those carbohydrates break down into glucose. This glucose enters the bloodstream, which causes blood sugar levels to rise. In response to this rise, the body releases insulin. Insulin then works to move that glucose from the bloodstream into the cells. Once insulin is released, it signals the body to store energy. Some of the glucose that enters the cells is used immediately for energy. But if there is more glucose than the body needs at that moment, the body stores that extra energy. Over time, some of the stored energy can be converted into body fat. When insulin levels remain elevated for long periods of time, the body stays in storage mode. Frequent eating or constant snacking can keep insulin levels elevated throughout the day. When insulin stays high, the body has a harder time accessing stored fat. As a result, fat loss becomes more difficult. This is why insulin plays such an important role in metabolism. Insulin helps determine whether the body stores energy or burns stored fat. When insulin remains elevated, fat storage is favored. When insulin levels fall, the body becomes better able to access stored fat and use it as fuel. In the next lesson, we will explore how fasting can help lower insulin and unlock stored energy.